Even if you don't have a dentist appointment, it's always important to brush your teeth. Does that smile shine? Lynn decides to brush one more time before she visits Dr. Wilson, the family dentist. The last time she saw him was 6 months ago. She tries to take care of her. Think about the last time you visited the dentist. What do you remember about your examination or checkup? Did you feel nervous before your appointment? How about after it? Teeth that aren't properly cared for often turn brown, break, or fall out. Her teeth and gums. But she's still a little nervous. What if she has a cavity? People depend on their teeth, jaws, and gums to eat, speak, and smile. That's why it's important to practice good dental hygiene. Many healthy dental habits involve preventing plaque buildup. Make a guess. How many teeth are in your mouth? Can you guess? Most 3-year-olds have a set of 20 baby teeth. These teeth start falling out 2 to 3 years later. They are slowly replaced by permanent teeth. You should have 28 permanent teeth by the time you're 13 years old. A dental hygienist is the person who cleans and counts your teeth. Bacteria react with sugar found in foods. This forms acid that wears away tooth enamel and forms cavities. Plaque also leads to gingivitis. This disease causes painful, swollen gums. Brushing teeth is one way to prevent cavities and gingivitis. Other ways are flossing and avoiding sugary foods and drinks. These everyday activities help support dental health. So does visiting a dentist at least twice a year. It's a good opportunity to ask questions. Dental workers are trained to use many tools. The dental exam. It's time for a closer look at Lynn's teeth. Ms. Cortez is the dental hygienist. She walks Lynn to the exam room and asks how school is going. Look at this picture of a dental exam. Why do you think the hygienist is wearing a mask and gloves? Why is the patient wearing a paper bib? What else do you notice? X-rays show dentists things they can't see from just looking in your mouth. Lynn sits in a large chair that leans back. Ms. Cortez switches on a bright overhead light. She asks Lynn to open wide. Ms. Cortez uses a mirror to examine her mouth. Ms. Cortez counts Lynn's teeth and takes a few X-rays. These photographs will help Dr. Wilson spot any hidden cavities or gum problems. Ms. Cortez shows Lynn what instruments she'll use to clean and polish her teeth. One is an electric toothbrush. Ms. Cortez lets Lynn choose either cotton candy or bubblegum toothpaste. Flossing is a good way to reach the food your toothbrush misses. Ms. Cortez sprays water and air inside Lynn's mouth as she works. She uses a small syringe to do this. The water rinses Lynn's teeth. The air dries them. Ms. Cortez drains any leftover water and fluids, such as saliva. She uses a suction tip to do this. This instrument is made from a small plastic tube attached to a hose. Ms. Cortez finishes by flossing Lynn's teeth. The dental exam is almost over. A dentist uses a tiny mirror to look around your mouth. What does the dentist do? Ms. Cortez tells Lynn to sit for just a little longer. Dr. Wilson and Lynn's mom come into the exam room. Ask questions. What clues do dentists look for as they search for cavities? How do they treat the cavities they find? Ask your dentist to help answer these questions. The dentist might give you some new dental supplies and show you how to use them. Dr. Wilson asks Lynn to open her mouth once more. He uses the mirror to examine her teeth and gums. He also checks Lynn's bite to see how her top and bottom jaws work together. If they are crooked, she might need braces. He says all her teeth are lined up correctly. She doesn't have any cavities either. Dr. Wilson tells Lynn to brush her teeth at least twice a day for 2 to 3 minutes each time. She should brush more than just the If you follow your dentist's tips, you'll have a healthy mouth and a bright smile, front of her mouth. It's important to clean the back and side teeth, too. Dr. Wilson wants Lynn to floss every day. He asks her to come back for another checkup in 6 months. Ms. Cortez hands Lynn a treat bag containing a toothbrush, toothpaste, floss, and sugar-free gum. Lynn knows she won't be nervous the next time she visits the dentist. Instead, she'll be prepared to show off her shining smile.